Cervical cancer is a cancer arising from the cervix. It is due to the abnormal growth of cells that have the ability to invade or spread to other parts of the body. Early on, typically no symptoms are seen. Later, symptoms may include abnormal vaginal bleeding, pelvic pain, pain during sexual intercourse, and sometimes problems with bowel and bladder function. While bleeding after sex may not be serious, it may also indicate the presence of cervical cancer. Human papillomavirus infection (HPV) causes more than 90% of cases. Most people who have had HPV infections, however, do not develop cervical cancer. Other risk factors include smoking, a weak immune system, birth control pills, starting sex at a young age, and having many sexual partners. But these are less important. Cervical cancer typically develops from precancerous changes over 10 to 20 years. About 90% of cervical cancer cases are squamous cell carcinomas, 10% are adenocarcinoma, and a small number are other types. Diagnosis is typically by cervical screening followed by a biopsy. Medical imaging is then done to determine whether or not the cancer has spread. HPV vaccines protect against 2 to 7 high-risk strains of this family of viruses and may prevent up to 90% of cervical cancers. As a risk of cancer still exists, guidelines recommend continuing regular Pap tests. Other methods of prevention include having few or no sexual partners and the use of condoms. Cervical cancer screening using the Pap test or acetic acid can identify precancerous changes, which when treated can prevent the development of cancer. Treatment may consist of some combination of surgery, chemotherapy, and radiation therapy. 5-year survival rates in the United States are 68%. Outcomes, however, depend very much on how early the cancer is detected. Worldwide, cervical cancer is both the 4th most common cause of cancer and the 4th most common cause of death from cancer in women. In 2012, an estimated 528,000 cases of cervical cancer occurred, with 266,000 deaths. This is about 8% of the total cases and total deaths from cancer. About 70% of cervical cancers and 90% of deaths occur in developing countries. In low-income countries, it is one of the most common causes of cancer death. In developed countries, the widespread use of cervical screening programs has dramatically reduced rates of cervical cancer. In medical research, the most famous immortalized cell line, known as HeLa, was developed from cervical cancer cells of a woman named Henrietta Lacks. Cervical cancer, a malignant tumor of the cervix, the lowermost part of the uterus, a malignant tumor of the lowermost part of the uterus womb that can be prevented by Pap smear screening and HPV vaccines. Signs and symptoms of cervical cancer. The early stages of cervical cancer are often completely free of symptoms. Vaginal bleeding. Contact bleeding, one most common form being bleeding after sexual intercourse, or rarely, a vaginal mass may indicate the presence of cancer. Also, moderate pain during sexual intercourse and vaginal discharge are sometimes symptoms of cervical cancer. In advanced disease, spread may occur to the abdomen, lungs, or elsewhere. Symptoms of advanced cervical cancer may include loss of appetite, weight loss, fatigue, pelvic pain, back pain, leg pain, swollen legs, heavy vaginal bleeding, bone fractures, and rarely leakage of urine or feces from the vagina. Bleeding after douching or after a pelvic exam is a common symptom of cervical cancer. Causes of cervical cancer. Infection with some types of HPV is the greatest risk factor for cervical cancer, followed by smoking. HIV infection is also a risk factor. Not all of the causes of cervical cancer are known, however, and several other contributing factors have been implicated. 1. Human papillomavirus. HPV types 16 and 18 are the cause of 75% of cervical cancer cases globally, while 31 and 45 are the causes of another 10%. Women who have sex with men who have many other sexual partners or women who have many sexual partners have a greater risk to genital warts, which are a form of benign tumor of epithelial cells. are also caused by various strains of HPV. However, these serotypes are usually not related to cervical cancer. Having multiple strains at the same time is common, including those that can cause cervical cancer, along with those that cause warts. Infection with HPV is generally believed to be required for cervical cancer to occur. 3. Smoking. Cigarette smoking, both active and passive, increases the risk of cervical cancer. Among HPV-infected women, current and former smokers have roughly 2 to 3 times the incidence of invasive cancer. Passive smoking is also associated with increased risk, but to a lesser extent. Smoking has also been linked to the development of cervical cancer. Smoking can increase the risk in women a few different ways, which can be by direct and indirect methods of inducing cervical cancer. A direct way of contracting this cancer is a smoker has a higher chance of cervical intraepithelial neoplasia CI and3 occurring, which has the potential of forming cervical cancer. When CI and3 lesions lead to cancer, most of them have the assistance of the HPV virus, but that is not always the case, which is why it can be considered a direct link to cervical cancer. Heavy smoking and long-term smoking seem to have more of a risk of getting the CI and3 lesions than lighter smoking or not smoking at all. Although smoking has been linked to cervical cancer, it aids in the development of HPV, which is the leading cause of this type of cancer. Also, not only does it aid in the development of HPV, but also if the woman is already HPV positive, she is at an even greater likelihood of contracting cervical cancer. 4. Oral contraceptives. Long-term use of oral contraceptives is associated with increased risk of cervical cancer. Women who have used oral contraceptives for 5 to 9 years have about 3 times the incidence of invasive cancer, and those who use them for 10 years or longer have about 4 times the risk. 5. Multiple pregnancies. Having many pregnancies is associated with an increased risk of cervical cancer. Among HPV-infected women, those who have had 7 or more full-term pregnancies have around 4 times the risk of cancer, compared with women with no pregnancies, and 2 to 3 times the risk of women who have had 1 or 2 full-term pregnancies. Diagnosis of cervical cancer. Biopsy. The Pap test can be used as a screening test, but produces a false negative up to 50% of cases of cervical cancer. Other concerns is the cost of doing Pap tests, which make them unaffordable in many areas of the world. Confirmation of the diagnosis of cervical cancer or precancer requires a biopsy of the cervix. This is often done through colposcopy, a magnified visual inspection of the cervix aided by using a dilute acetic acid, for example vinegar, solution to highlight abnormal cells on the surface of the cervix. With visual contrast provided by staining, the normal tissues are mahogany brown with Lugol's iodine. Medical devices used for biopsy of the cervix include punch forceps, colposcopic impression. The estimate of disease severity based on the visual inspection forms part of the diagnosis. Further diagnostic and treatment procedures are loop electrical excision procedure and cervical conization, in which the inner lining of the cervix is removed to be examined pathologically. These are carried out if the biopsy confirms severe cervical intraepithelial neoplasia. Treatments. The treatment of cervical cancer varies worldwide, largely due to access to surgeons skilled in radical pelvic surgery and the emergence of fertility-sparing therapy in developed nations. Because cervical cancers are radiosensitive, radiation may be used in all stages where surgical options do not exist. Surgical intervention may have better outcomes than radiological approaches. In addition, chemotherapy can be used to treat cervical cancer and has been found to be more effective than radiation alone. Evidence suggests chemoradiotherapy may increase overall survival and reduce the risk of disease recurrence compared to radiotherapy alone. Perioperative care approaches, such as fast-track surgery or enhanced recovery programs, may lower surgical stress and improve recovery. After gynecological cancer surgery, microinvasive cancer stage IA may be treated by hysterectomy, removal of the whole uterus, including part of the vagina, for stage IA2. the lymph nodes are removed as well. Alternatives include local surgical procedures, such as a loop electrical excision procedure or cone biopsy. Treatment depends on stage. Treatments include surgery, radiation, and chemotherapy. Medical procedures. 1. Teletherapy external beam radiation. Therapy is a form of radiotherapy that utilizes a high-energy, collimated beam of ionizing radiation from a source outside the body to target and kill cancer cells. 2. Brachytherapy. Brachytherapy is a form of radiation therapy where a sealed radiation source is placed inside or next to the area requiring treatment. Brachy is Greek for short. 3. The loop electrosurgical excision procedure is one of the most commonly used approaches to treat high-grade cervical dysplasia and early-stage cervical cancer discovered on colposcopic examination. In the UK, it is known as large loop excision of the transformation zone. It is considered a type of conization. 4. Radiation therapy or radiotherapy is a treatment using ionizing radiation, generally provided as part of cancer therapy to either kill or control the growth of malignant cells. It is normally delivered by a linear particle accelerator. 5. Cervical conization refers to an excision of a cone-shaped portion of tissue from the mucous membrane of the cervix. Conization is used for diagnostic purposes as part of a biopsy and for therapeutic purposes to remove precancerous cells or early-stage cervical cancer. Like, subscribe and follow My Health by Dr. J for more health videos. Thank you for watching. Bye.